Hey everyone, I have a very special guest, Dr. Westman, Dr. Eric Westman, medical doctor, associate professor, chairman of the Obesity Medical Association, also a doctor at Duke University, right?
Yes.
Yeah, that's what I thought. So I'm really excited to have you and just to ask you some questions. And by the way, guys, I got Dr. Westman to speak at our summit, the Keto Health Summit. I'm very excited. I'm honored to have you. You have a lot of great data. I know we've just talked before this, and you have some really interesting things that you're working on, some great things that we're not going to actually tell them right now, but we can maybe tease them a little bit. You just told me, you said you're doing some research, you stumbled on an observation that's quite profound, and it has to do with like someone stalled, right? Yeah. We won't tell them what that is, but at the summit, we're going to fully go over that. So I'm really excited, and it's very interesting. And I think that if you're not in a clinic setting, you probably won't pick it up. But the thing I like about you, Doc, is that you're in the clinic, you're working with people one-on-one, so you have a whole different experience than some other people that have, became maybe a keto expert through reading books. When you work on someone, that's when you really figure things out. So thank you for coming on.
Well, my pleasure, and I'm looking forward to being at the Dr. Berg Summit. I was visiting a clinic in China recently. I think the first keto clinic there.
Wow.
And one of the people who had a website and a big following for keto, I asked her, so who do you follow in the U.S.? Who do you know? And she looked and said, well, Dr. Eric Berg, of course. So you're having a reach way beyond the U.S., and I think they translate a lot of the videos into Chinese as well.
Wow.
So congratulations on what
That's good. That's good. Now I'm going to have to fly out there and meet her.
Absolutely. It's a bit of a hike, but
yeah.
Well, it's my pleasure to come and talk and hopefully answer questions that people have. After 8 years of clinical research at Duke, we opened the Lifestyle Medicine Clinic 12 years ago now, and we've been using the keto diet as the main treatment for people. And as you said, the clinical experience is, as you know, in your practice, you have to have something work for this person, or they're not coming back.
Right.
So you can't just give out information and expect everyone to follow it perfectly and have it get it right the first time. But so I'll hope to share some of the things that I've learned, not only from clinical practice with people, but we're learning now about stalls and about how to help people through them. And a lot of it has to do with how our bodies adapt to ketosis, or how the ketones are and all that. And I hope to share, I will share some data that no one else has seen at your summit, if that's okay.
I'm excited about we want you to share that fully. Because when I was in practice, it pushes you to keep pushing that bar up, because you'll have, I don't know, you're probably similar to me, that if you're not getting 100% results, you'll go home and think about that small percentage of person who didn't get well, and you're like, okay, we got to crack this case. But when we got into keto and really made that work, those results just came up higher and higher and higher. So, I know exactly what you're talking about. It pushes the bar to figure things out. Now, I want to know your relationship to Dr. Atkins. I think you knew him. I think you did some research for him, or tell me briefly what that experience was.
Sure. Yeah. So back in 1998, so it's been a few years. My first experience was through two of my patients at the VA hospital here in Durham, North Carolina, and they had these phenomenal results. I asked them why and how, and they mentioned the Atkins book, and they were following it. So I tracked him down in New York City, and he invited me up to visit the clinic. And it didn't convince me to do it, but it did convince me to ask him for money for research. So we asked Dr. Atkins to fund our first study. It was good, and so then we went back and requested that he do the next one, and that paper was in the Annals of Internal Medicine, now going back 2004. Will Yancey, my colleague at Duke, who's now the director of the Duke Diet and Fitness Center, was the first author on that paper. But so, I was intrigued, and then as a clinical researcher, felt compelled to collect data to look at the safety. So I knew it could work. 2 of my patients had it work. That was pretty clear. But what was not clear is the safety of it. And, even today, people fear eating fat, not rationally. It's not scientific, but people have that fear. And so can you imagine 20 years ago, people were really afraid of it. And I really didn't know the hornet's nest I was getting into, which is probably a blessing. I probably never would have done the first studies. It was through my patients. And then I never worked for Dr. Atkins. There's some mistaken belief about that. But I asked for money, and actually he passed away, slipped on the ice in New York City, right as the second paper was coming out in the Annals of Internal Medicine. So he never got to see that, but he knew the results that were happening in his practice. So years pass, and the scientists who were doing the keto research were asked to become authors on the New Atkins for a New You book. Mm-hmm. So I'm an author on that book. Steve Finney and Jeff Volek are co-authors with me.
Wow.
And that was published in 2010. It took me a while to warm up to the idea that this could be safe and effective. And now I have to believe that part of the explosion of keto, low carb, high fat, LCHF is because there's such a scientific basis for it.
Yeah.
You really can't credibly push back against it. I mean, there will always be people who criticize it and have their own agendas and all that, but the science base is really solid now.
Wow. Now, what's really interesting, what I'm impressed about you, you're in the clinic, you're a medical doctor, you're used to doing medicine, but your treatment is the ketogenic diet. So you're not writing prescriptions all day long, right?
I take them away from people.
God,
I'm just impressed. Just changing the food.
That's so mind-blowing. Now, you're the chairman of the Obesity Medical Association, right?
Well, I have to correct you. I'm past chairman.
Oh, past chairman. Okay.
Because every year it changes. So I'm still as an ex officio on the board, but I've been through the leadership of the Obesity Medicine Association, which is the largest group of obesity medicine doctors in the world.
So the question I have is, you have this viewpoint on mainstream obesity, and then you have your viewpoint, or the new viewpoint we're talking about, keto. Are these guys fighting it? Are they accepting it? Are they going, wow, this makes sense? Or are they going, well, you do your thing, I'll do my thing? How is the interaction with that viewpoint?
Yeah, well, we've been teaching the ketogenic diet or low carb diet, variations of that, for about 10 years at Medicine Association meetings. So most of the doctors are familiar with the diet. They don't always use it solely in the practice, but this group of doctors has the requirement that what they do has to work. Or many of them are cash practice outside of insurance, and if what they didn't work, they wouldn't have a job, right?
Right.
So,
not like the government where you could not get results.
Yeah, or even just a doctor in an insurance or HMO plan. What they do doesn't have to work.
Right.
They still get paid. But so the ketogenic diet, I would say a small fraction of the Obesity Medicine Association members use the keto diet. Maybe 5% of 2,000. Now, Gary Taubes, just to talk about how it's spreading, Gary, who wrote Good Calories, Bad Calories years ago, is working on a book about doctors using the ketogenic diet. And I heard him give a talk this last weekend, and he's actually found over 100 doctors who talk freely about using it. So the times are changing.
Wow, this is really good news. I didn't know that. That's very exciting, because that's really, people trust their medical doctor. They go there, they want to get something that works. And once you put them on this, so many other factors clear up, as you know. So now I also want to bring up another point that's interesting. Before the discovery of insulin giving before all this medication for people with diabetes. I guess it was like 1914 to 1921. What did you use back then to actually help people with diabetes?
Yeah, 100 years ago, before there were any medicines, doctors used this kind of diet to treat diabetes and to help people lose weight. So yeah, I have a old book, now tattered pages from a book that was given to me from 1923. And in there, the list of foods is very similar to the list I use. And so for the right patient, I'll bring that up. And although some people don't want to know that it's not new. So there's a double-edged sword there. This isn't new. I'm not going to do it. Actually, we've learned a lot since then, not only how to do it for lots of different people, but also the mechanisms of how it works. And, the idea of ketosis wasn't really understood at all. But yeah, this is nothing new. Oh.
Wow. That's fascinating. And then the other point I want to bring up is when we talk about normal sugars, people have this confusion. They don't know what that means. They might say like 80 units, whatever. Tell us the amount of sugar that you would see in a normal, healthy person for all of their blood, which we have about 1.33 gallons of blood. How much sugar is actually in there to be considered as normal?
Yeah, so this calculation is so simple, and it's using algebra from middle school algebra now. So if you take 100 milligrams per deciliter of a normal blood glucose and multiply that by the 1,000 milligrams per gram, 10 deciliters per liter, and you understand there are about 5 liters of blood in an adult, that works out to about 5 grams of glucose in the bloodstream at any given moment. If you have, so that's about a teaspoon of sugar in the bloodstream at any given moment. And if you double that, you have diabetes. And so
Awesome.
it's amazing that we're not all diabetic. The insulin from the pancreas is working hard to keep the blood sugar down. But I've had endocrine professors tell me that they never thought of that before. So even the mainstream endocrine doctors aren't really taught much about the diet, but they're very knowledgeable about the medications. And I've kind of lost touch with using medicine because, as you mentioned before, I take medicine away from people because they no longer need it.
So guys, I don't know if you just heard what he said. Basically 5 grams, that's 1 teaspoon is normal blood sugars, 2 is diabetes. I mean, you got to let that sink in a little bit because an average American probably consumes more than at least 25 teaspoons of sugar every single day, which is incredible how they do have prediabetes. I mean, 65% of the population has it.
Yes.
Incredible. Doc, I know you got to get back to your patients. I just wanted to ask you some couple questions and say hello, and also tell everyone we're going to both be at the summit coming in October 13 and 14. I'm very excited to have you out, and thank you so much for doing this talk.
My pleasure. I think this is going to be the best summit ever.
Thank you. Awesome. Okay, we'll see you later.
Bye-bye.